Addiction isn't just about substances. The physical dependence is only one facet of a much larger, more complex issue. It's often deeply rooted in pain, profound loss, a persistent longing for something more, and a fundamental sense of disconnection from oneself and others. These emotional wounds can drive addictive behaviors. It impacts the body, mind, and spirit, creating a ripple effect that touches every aspect of a person's being, in ways that can feel overwhelming, leaving individuals feeling trapped and powerless against the relentless pull of addiction. The weight of it all can be immense. And for many standard treatments, the conventional approaches, therapy and medication, the cornerstones of addiction treatment, don't feel like enough, leaving a void that yearns to be filled. They may seek something more, a different approach. That's when some people turn to energy healing, seeking alternative pathways to recovery and wholeness. What exactly is energy healing? What does it entail? It's anything from Reiki and healing touch, hands-on techniques that aim to restore balance, to distant sessions aimed at balancing an unseen life force, working with the subtle energies believed to flow through and around us. But does it actually help with addiction recovery? Is there any real evidence to support its use? Today, I'll look through the lens of peer-reviewed science, examining the research and data. No fluff, no wishful thinking. We'll stick to the facts and see what the evidence truly reveals. Let's start simple, with the basics. Many clinical studies on Reiki, healing touch, or distant healing have been conducted over the years. Show small benefits, modest improvements in well-being, reduced stress, improved mood, a sense of calm. Participants often report feeling more relaxed and at peace. But here's the challenge, the critical point to consider. Much of the evidence comes from small or poorly controlled studies. This makes it difficult to draw definitive conclusions. It's hard to know if the effect comes from energy, the purported mechanism of action, or simply human attention, relaxation, or placebo. The power of belief and the therapeutic relationship can't be underestimated. Next, we have energy psychology, a different category altogether. Methods like emotional freedom techniques, or EFT, a popular and widely used approach, where tapping on acupressure points is combined with emotional expression, a unique blend of physical stimulation and psychological processing. Research, more than 50 randomized trials, have investigated the effectiveness of EFT, shows EFT can reduce anxiety, trauma symptoms, even cravings. The findings are promising, suggesting potential benefits for mental health and addiction. But here's the important question, the critical factor to consider. Is it the tapping, the physical act of stimulating acupressure points, or the talk, focus, and intention that brings the benefit? Is it the energy or the psychological process? Some experts say it's the psychological work, the cognitive and emotional processing involved, not mystical energy, that drives the impact. It's the therapeutic techniques, not the unseen forces. Now let's turn to what the highest quality studies say, the most rigorous and well-controlled research, specifically about addiction. What does the best evidence tell us about treating addiction? Enter Mindfulness-Oriented Recovery Enhancement, or MORE, a promising approach. This clinically tested program blends mindful attention, cultivating present moment awareness, emotional insight, and savoring life's positive moments. It encourages a shift in perspective and a greater appreciation for the present. In multiple randomized trials, the gold standard of research, complete with brain scans, craving assessments, and misuse tracking, objective measures to evaluate its effectiveness, MORE has been shown to reduce opioid use, ease cravings, and lift mood. The results are compelling and offer hope for those struggling with addiction. This is rigorous science with real-world results. Evidence-based and effective. Spiritual approaches also matter. They play a significant role in many people's recovery journeys. We've seen consistent evidence that 12-step programs like Alcoholics Anonymous and Narcotics Anonymous, which include a community and spiritual component, offering connection, support, and a sense of purpose, offer modest but meaningful benefits compared to other therapies. They provide a valuable framework for recovery. The difference isn't magical energy, it's not about supernatural forces at play. It's structure, shared experience, accountability, and meaning. These are the key elements that contribute to their effectiveness. So, where does that leave energy healing in addiction recovery? What's its place in the overall picture? Here's the honest truth from the evidence, based on the scientific findings. It can support relaxation and emotional comfort, providing a sense of ease and well-being. but it shouldn't replace proven treatments. It's not a substitute for evidence-based therapies. Think of it like a supplement, an addition to your overall recovery plan. A gentle companion to evidence-based care, not a cure in itself. It can be a helpful adjunct, but not the primary focus. If Reiki or healing touch helps you relax after a long day, reducing stress and promoting relaxation, that's valuable and real. The benefits of relaxation are undeniable. And if tapping helps quiet anxiety or craving, providing a sense of relief, that has merit. It can be a useful tool for managing difficult emotions. Just be clear-eyed, maintain a realistic perspective. The strongest science supports mindfulness therapies which have a solid evidence base. Structured support and trauma-informed care, approaches that address the underlying causes of addiction, as primary tools in recovery. These should be the foundation of your treatment plan. Know this: healing is deeply personal. It's a unique journey for each individual. It may involve medicine, meditation, therapy, a combination of different approaches, connection, or even energy work. The path to recovery is multifaceted and diverse. What matters most is that it helps you feel better, safely, and in a way that promotes long-term well-being, and keep moving forward. Progress, not perfection, is the key. You deserve a recovery path grounded in hope and truth. A path that is both optimistic and realistic. And the science is here to guide you every step of the way, providing evidence-based information to support your journey.